Hi, just a quick introduction since you can only hear my voice. My name is Erin, and I'm doing the MLT to MLS online track, so that's why you never see me. I live down in the western part of Kentucky, and I work at a local hospital. I absolutely adore my job and most of my coworkers. The laboratory is the perfect place for me to be, especially since I'm not a big fan of patient contact. I wanted to find an interesting topic to do my presentation on. My first thought was to do salmonella, since we have had several cases at our hospital over the summer. After I signed up for it, I realized that there were two other people that were also doing a salmonella species. So after some debate in my head, of course, I decided to do something that was much less common. To make it even harder on myself, I picked a bacteria that I have never seen in person, Mycobacterium leprae, also known as leprosy or Hansen's disease. At least it's interesting, right? Leprosy is a slow-growing acid-fast bacilli, like many other Mycobacterium species. It is a booger of a bacteria that does really gross things to a person. It causes nasty skin sores and nerve damage. It has been known to cause paralysis in hands and feet. Luckily, it's not super common, and you more than likely will not have to deal with it unless you move to a place where it is more prevalent. Even if you do come across this bacteria, you probably won't catch it. It is spread through droplets. Contrary to popular belief, it is also highly unlikely that you will get this from touching an armadillo. But you might want to stay away from the armadillo anyway, since they are known carriers. You know, just in case. However, if you have touched an armadillo and are developing a rash, personally, you might have that seen about. An issue with leprosy is since it is such a slow grower, you may not even realize you have been infected for many years. If you do wind up with a flaky sore and have a history of being around a possible case, the doctor will do a skin biopsy to determine if you have the bacteria. Even so, depending on what stage it is in, it may not show up. You can't exactly culture it in a normal laboratory setting. However, some far-off scientists in Thailand are working on a PCR technique to amplify the organism from a tissue sample. Interesting fact though, the only way to culture it is on armadillo foot pads. Yes, I know we just went over this in class not too long ago, but I happen to think it's really cool. So here's a picture of a cute little armadillo for your enjoyment. There's a stigma that is associated with the disease if it is in a more advanced stage. The people that have skin sloughing off tend to be social outcasts. But as I said before, as long as they're not coughing and sneezing on you, you're probably safe. But who really wants to risk it? Fortunately for us, it is easily treated, but some folks around the world might not have the same options as us. When you are diagnosed with this disease, hopefully while it's in its early stages, the doctors will treat you with a couple of antibiotics to be sure to kill the little bugger. They will prescribe rifampin, dapsone, and maybe even a third drug called clofazimine. Hopefully these antibiotics will take care of it, but if complications develop, those are to be taken care of as the need arises. If caught late, you may have some lasting effects with your nerves and some leftover physical defects, but we will just hope and pray that that's not the case. So, I do have a quick case study for you guys, since this is a case study assignment after all. Okay, so we have a 34-year-old woman from Mexico. Her previous home was in South America. She kept many pets in her home and recalls seeing many armadillos in her neighborhood. She complained of a rash all over her body, cramping in her arms, and needle-like pain in her wrist and fatigue. Upon examination, she had lesions on the bridge of her nose, cheeks, abdomen, and back. She had thinning eyebrows, and some of her nerves in her forearm appeared to be damaged. So, can anyone guess what the doctor ordered? A skin biopsy and smear were performed. Microbiologists called acid-fast bacilli. She was diagnosed with multibacillary leprosy. This just means she had 6 or more lesions. The doctor prescribed dapsone, clofazimine, and rifampin to be taken over a period of 2 years. Laboratory tests were used to monitor liver function over the course of the treatment. Alright guys, so that's it. Here's some fancy links about leprosy if you would like to learn more. Have a good day and good luck in the program.